Let's do Frontline. On Frontline today, I bring you more of the experiences of our frontline health workers. I'll take you to the Kolebu Teaching Hospital. We'll be talking to an infectious disease specialist there as well. You also hear from officials that are supporting all of you in the front line and urging you on, making you know that we're here for you. You hear from my own colleagues here at JoyNews who say we are with you. Before I get on to take you to the Kolebu Teaching Hospital, where we'll be talking to Sheikh Ibrahim Ibn Sana, I'd love for you to take a look at this video we've pieced together.
It's not easy. We are coping. Sometimes when you go home, you can't even get near your relatives. They said, hey, are you bringing some of the condition? So we start removing our shoe outside, putting our things outside. Just enter into the bathroom before you even come close to them.
My name is Lexus Bill. We actually are grateful eternally to all our frontline staff, our doctors, nurses, our policemen, our officials, as well our military men who are ensuring that we're staying at home. All of you are our heroes. God bless you, and thank you so much for all that you're doing for Ghana. God bless you.
Over the years, I've had a fair appreciation of what not only medical doctors, but all health professionals go through during this period that COVID-19 is threatening our very existence as a people. We would like to say a very, very big word of encouragement to all health professionals who have put themselves in the front line. Keep up the good work, and we pray that together, as we all support you, all of this will come to an end. My name is Nathaniel Atto, and I'd like to say thumbs up to every single health professional at the front line of all of this.
To everyone out there who is a health worker, our nurses, our doctors, physician assistants, all the frontliners who are giving out their all in order to help the sick, and to the frontliners, especially those handling our patients who have been affected with the coronavirus. I say may God bless them. May God give them the energy, the strength in these trying times to be able to help all patients. May God bless them. Aiko Ghana Damase. Thank you from Mrs. Morgan.
And Mrs. Morgan ends it there for us. Thank you, Mrs. Morgan. Wherever you are, we want you to also send your videos. If you have a song, you have a poem you can post for those people who are putting their lives at risk, just so we'll bring you information and also to give you health advice. You want to send them through to our WhatsApp platform. We'll put the number there. There it is for you. 0540109009. Let's hear from you. We'll also open the phone lines now. I'm sure that you've seen this video that's been going around. It was put together by GIPC. In that video, they assemble doctors and health professionals essentially that are urging you to stay at home. Well, I'll be talking to them here on Frontline as we go along. I have one of them who's on standby for us. He's joining me via Skype. Sheikh Ibrahim Ibn Sana is a public health and infectious disease pharmacist. He's also head of pharmacy unit at chest diseases at the Kolebu Teaching Hospital. Doc, it's good to have you. Thank you so much. Sheikh.
Thank you for having me. I'm very grateful.
Right. We're going to open the phone lines and ask people to talk to you or share with you the encouraging messages for you. But I want to start by asking you, how has COVID-19 changed the way you know life to be?
Thank you very much for this. First, let me take the opportunity to greet the Imam, head of the constructive classes unit. He got up this idea that about it when he mobilized and educate the public, and life has never been the same. COVID-19 has revolutionized health care. I think that the health workers now in our country, this is a situation. Our lives are at stake. We are the last men standing and ensure that we save the planet from this pandemic. We are doing all we can, and we hope we will defeat it. The support, courage, as well as support from the public. And I must say that we are overwhelmed. I support the press and encourage. As we encourage our last best pandemic is defeated in this.
Sheikh, I'll have to just pause you on briefly there. We're having a little issue with the smoothness of the line, but I want to really hear what you're saying, and I want my viewers to also be able to hear what you're saying. Let's try and raise you up on the phone line, and then we can hopefully hear you better. But as we work on that, take a listen to the Deputy Health Minister today on just how much those at the front line mean to us.
Fellow Ghanaians, my name is Alexander Kojokom Aban. I'm the MP for Gomwa West and the Deputy Minister for Health. Stay home means stay home. Please do that for Mother Ghana, do that for yourself. And as you do that, you actually facilitate the work of the frontliners as they go to look for those who may have been in contact with those who traveled. And of course, as they look for those who traveled, it is in our collective interest. So please stay home and let the frontliners do their work for yourself, for me, and for Mother Ghana. Thank you.
Well, you had the Deputy Health Minister there. I'm going to take you back to the Health Ministry, and we'll hear from the technocrats as well.
Fellow Ghanaians, my name is Dr. Mrs. Martha Jansalutrot. I'm Director Technical Coordination at the Ministry of Health. Stay home means stay home. But must you go to the hospital? We want to plead with you. Be transparent about your travel history. Tell the health worker where you have been so that we will be able to provide you the care you needed. If you hide your travel history from us, you are endangering the health worker. The health workers must be there to help. Help us help you. Stay home. Thank you.
Let's hear from the CEO of the Ghana Ambulance Service.
I'm Professor Ahmed Nuhu Zakaria. I'm the CEO of the Ghana Ambulance Service. Obviously, as you are all aware, the paramedics are part of the frontliners in the combat of this COVID-19. And the role of the emergency services, especially the pre-hospital emergency care system, is the fact that for every country to succeed, you will definitely need a system where the translocation of patients is very effective. So on that note, we really want to encourage everybody to stay at home and stay safe. The earlier we bring this pandemic to a halt, the better for all of us. And so the best way to access the emergency services is just to stay at home and stay safe.
Now, when you stay at home, what you do is that you're preventing the spread of coronavirus, and it reduces the pressure that is brought to bear on the people who work at the front lines. So I'm going to take you back to Kolebu Teaching Hospital. Some of you are still sending in your messages. I'm grateful for that, saying thank you to them. I still have Sheikh Ibrahim Ibn Sana. If you have questions about coronavirus, if you have any encouraging words for people like him who are at the front lines dealing with you on a daily basis, you can call these numbers on your screen, and I'll push them through to Sheikh Ibn Sana. Sheikh, it's good to have you once again. You were telling me about how COVID-19 has changed the way that life has been for people like you who are at the front line.
Exactly, my dear. Prior to COVID-19, I am in the, the Department of Infectious Diseases.
Yeah.
We deal with tuberculosis, which is close to COVID-19. Just that the incubation period of COVID-19 is 2 to 14 days, while that of TB is 3 weeks to 1 year. And then also the element of difference is the fibrosis. Fibrosis occurs faster. Fibrosis is your lung turning into fibrous nature, becoming hard, the lung losing its elasticity. So we are very much particular with this. But wearing of masks has not been a factor, has not been mandatory for many people, even when they come to the department, health workers inclusive. But when COVID-19 came in, everybody's life has been changed. Everybody is very much particular about wearing face masks, N95, taking precautions with regard to sanitizing our environment, our hands, using hand sanitizer, using aprons. So life has never been the same for any health worker, especially for those of us at the forefront. COVID-19 tells you that your life is at stake. When you contract the disease, you may go. So you do everything possible to ensure that your life is protected. But then, because you have sworn an oath to protect the general public, your life is secondary, even though you take precautions. But your main duty is to save the patients, to save the public who are coming in day by day. Some are coming in to check, some are suspected cases, and we are dealing with them adequately. The chief executive of Kolebuti Hospital, Dr. Sari, and his lieutenant management, they are on daily basis checking on the wards, checking on the patients, and they are ensuring that all that we need are supplied, even though we have a number of challenges. We think that they are also up to the task to ensure that we together we can combat this pandemic.
Okay.
We hope the public.
So, Sheikh, sorry to interrupt you there. I have a couple of people who have called on the line right now. I'll let them just push their questions or whatever it is they have to say to you right on. I have Gordon Anyomi, who is calling from Hohoi. Hopefully, I haven't lost Gordon. Hello, Gordon. Okay, looks like we've lost him. Let me take you to Tamale. Amadou is joining us from Tamale. Hello, Amadou.
Hello, good afternoon, madam.
Good afternoon. Sorry for keeping you waiting. Amadou, we do have Sheikh Ibrahim Ibn Sana.
I want to ask Sheikh. There are people in Tamale teaching hospital where the suspected case was tested and become positive. And they tested them. I know the incubation period of this virus is 14 days. After testing them the first time, and they are negative, they allow them and they are roaming with us in summer.
But did you say they are negative?
Two sort of them to quarantine them for 14 days to retest them to see whether they are negative or positive. Within that short time, when they test them and they are negative, it has just become a good news for them that they are negative. So they allow them to remove.
Okay, so you want to find out from Doc whether those people should be moving around or should be having quarantine?
They should have quarantined them for 14 days. Who knows, before the government lockdown the effort, look at the people that they quarantine, look at the later on the virus, how they are getting cases.
All right. Thank you very much for calling from Tamale. I have one more question, a caller from Kanishi. Robert is on the line. Robert, what's your question or what's your encouraging words for our frontline workers?
Good afternoon, Gifty.
Good afternoon.
In fact, continue with your smile. It always keeps me away. And I like it. And in fact, I want to encourage the front line. In fact, they are doing very good work. For instance, yesterday, at your station, you show at Waja where they were moving. There was no PPE for them. They were complaining, but yet still, you realize that they were trying as much as possible to go and do the work.
Yeah.
And myself and my wife, every dawn, will be praying for them. And we hope that God will continue to protect them so that in receiving the patients, they will not receive virus as well. God bless them, and they should continue the good work. Amen.
No question, and then we'll have a Sheikh answer or speak to them, and then we'll do the next round of 3. Albert is calling from Saboba. Albert, how are you?
I'm fine, madam.
Albert, talk to us.
All right. I want to thank everybody for the way and manner we are approaching the pandemic. I really appreciate what the health workers are doing. and the government as a whole. But my concern is much attention has not been given to especially our health sector. So I don't know. You realize that especially nurses of this country, until such things like this happen, and we now turn our attention to our health system. You have nurses who have completed since 2017 and have not been posted. And our health system have inadequate, nurses in the facilities.
Okay.
So things like this has really prompted us to the needs of our health system and where we should place our priority on.
Okay, all right.
I want to thank you so much.
Thank you very much for calling. So let me come to you, Sheikh, for some answers, if you can help us with them. He's saying that in Tamale, at the Tamale Teaching Hospital, some people were tested, they proved negative, but he thinks that those people should have been quarantined. But as far as he's concerned, they are walking around. Is anything wrong with that?
I think that in the first place, the incubation period of the virus is 2 to 14 days. Like I was just supposing with tuberculosis, which is 3 weeks to 1 year. When it happens like that, within the first 2 to 14 days, anything could happen. You could test negative in the first time, but within the next 3 days, you could, be positive. So what we want the government to be doing or facilities to be doing is that those people must be closely monitored. They can do self-isolation in their homes, at least for the next 3 days, to retest again to find out if they are indeed negative. Because once an individual is a suspected case, then everybody is watching as what would happen. So in order to remove the stigma around the person, a reconfirmatory test the next 3 days or 4 days can free everybody's mind that this person is indeed negative. Because suspected cases come in when we are sure that this particular person might have come into contact with a positive case. We want to break the transmitting chain of the disease. And that is why, following them and then ensuring that they are risk tested within a short time is key. We are aware of the challenges government is facing, but we are sure that if we do this, we'll be able to arrest it on time.
Okay.
I must also say that there are challenges in the system. For example, in Kolebu here, we don't have enough PPE, we need a public support us, we need N95, we need ordinary face masks, we need aprons, we need sanitizers, we need Veronica buckets, anything that could support in the fight against COVID-19, we need them. The public can come in and donate to us, individuals, NGOs, they can come in and support, because this fight, we are in the forefront. But we need all the citizenry of Ghana to be behind us to ensure that we can combat this pandemic effectively.
Appeal there for donations. Of course, the entire world has been asking for donations. So I will share with you my viewers, a screenshot of something that's going round. I think some doctors could bringing themselves together to ask for some donation. I'll show you how you can help those doctors. But Sheikh, there was another person who was asking about the number of nurses who have not been posted and the fact that this is a time where we may need those people. What's your perspective on that?
I think that at this particular juncture, any person that is trained, that has had a minimum of training in health, is needed. We need all hands on deck. I'm sure in the coming days, the Minister of Health and the government itself, government machinery, will think about something like that, so that people who are staying at home can even be employed temporarily. You can use the municipal authorities or the district assemblies to get the people to work. Since you are already trained by our resources, the state resources, this is the time we need them. We can rope them in for this period and then ensure that they are remunerated, motivated very well to help fight the disease. Because one of the key things that is lacking is the human resource capacity in terms of health. Human resource infrastructure, there are still some gaps. But the human resource personnel, we have a lot of challenges. I know it is because of resources, budgetary constraints that we have as a government and as a nation. But in times like this, let's try and reach out to those people because these are not ordinary times. We need everyone who has the knowledge of how to care for patients, how to support, how to even transport victims from one place to the other, how to even educate people, how to convey information. All those people are needed. I think we don't have enough people. I think that anybody that wants to be a volunteer, the government must give a listening ear to it and then ensure that the person comes on board to come and support. So I say in the view that people who are not been taken on board, health personnel who have been trained but have not been taken on board, government should find a way of ameliorating their situation so that they can augment the staff that we have.
Okay, let me take this final call and then I'll do a quick another interview, bring someone else into this discussion. Emil is calling us from Kumasi. Emil?
Yeah, good afternoon.
Good afternoon, Emil. Talk to us.
All right. Let me begin by first and foremost commending you for this wonderful initiative of introducing the Frontline, where we can celebrate our heroes and heroines who have dedicated their lives, even at the peril of their lives, to save lives. And what I want to tell Sheikh is that we are very much grateful to them. We pray that God will continue to sustain them, God will continue to lift them up, God will continue to insulate them. They will be delivered from any form of infestation. Amen. They will be strong. We are very proud of them. We doff out our heart out to them. And I personally want to begin this. I, Emil, pledge at all times to stay at home and only go out when the need be. Thank you very much.
Thank you so much. God bless you. I'm sure that our doctors and our frontline workers who are listening or watching are very touched by your words. Encourage others around you to stay at home as well. I'll read just this message and then I'll introduce someone else who joins us on the line. Frontliners, he says, are like a field of flowers who has covered our life with a flower of their true self. Frontliners fill our life with beautiful and inerasable memories that have become unforgettable mental files encrypted in the chamber of our soul called the world. Stay safe, frontliners. Stay safe, Team Mobek members. From Etuahene Kenneth at the University of Energy in Sunyani. Now, it's been 5 days since the lockdown in Greater Accra, Greater Kumasi, Kaswa, and some parts of Tema. Stories about persons attempting to flee the restrictions have been the order of the day. But what really is the regional impact of the lockdown, especially areas which are not affected by the lockdowns? We'll be speaking to a member of NDC's COVID-19 team about this following their statement yesterday, offering some recommendations to government on the management of the virus. Dr. Vida Nyagre Yakbong is a senior lecturer at UDS Tamale. She's currently the Vice Dean of the School of Allied Health Sciences and was also the head of Department of Midwifery. I'll talk to her. We'll take a message for the Frontline, and after we're done with Frontline, we'll go back to her and have that conversation. Hello, Doc.
Hello.
Dr. Yagbon, thank you very much for your time. I'm going to talk to you in detail, but before that, I'd like for you, on this segment, we're looking at Frontline. We're talking about those are the front lines, and we'd like to appreciate them and address every issue that concerns them. So I'll take your message for these people on the front line, and then we'll wrap up with Frontline, then we'll have our conversation separately.
Okay.
So we're listening to you. What message do you have for those at the front line?
Yeah, first of all, I really want to appreciate them. Globally, it has been an issue when it comes to the frontline health workers. And if we look at statistics out there from China, Italy, Spain, and all of that, the majority of those who have been affected, when you look at their confirmed cases, are also frontline health workers. Right. So it means that these are people who are vulnerable, if we look at it that way. And we should pay attention to their needs. We could mobilize all the money, the infrastructure, and what have you, but if we are not able to have our frontline health workers stay at home, if they lay down their tools, then all that we are mobilizing will be useless. Who will be there to take care of them? And so for them to lay their life and then to want to save lives in this nation, I think that we should do our best as a government to respond to their needs as soon as possible. I think it has even been over-delayed. Right. So I want to continue to urge them to be committed, but also have a voice. And when conditions are not good, they need to speak about it. And then the government must listen to their voice.
Okay, so that is the message for frontline workers. Let me come to you again, Sheikh Ibrahim. Sheikh, are you there?
Yes, I'm available.
Right. So let's wrap up our conversation. I'm not sure that we'll be able to take any more phone calls. So let's wrap up our conversation before I go on to talk about the lockdown with Dr. Yagbon, who is, by the way, appreciating all the work that you've been doing. I'd like for you to give us your final words, if any, at this point.
Thank you so much. My final word that I want to give is that people should take this opportunity to assess themselves in terms of how well they take care of their health, and then the precautions that they take in their offices and their workplaces. I would also like to take the opportunity to sensitize the general public about tuberculosis, because tuberculosis, especially those who have MDR tuberculosis, there are some similarities, very, very close similarities between COVID-19 and tuberculosis. And we know that tuberculosis kills, and it is in our general public. So please, when you have a productive cough, plus all the other signs, the weakness, the fever, the sneezing, then you are thinking of tuberculosis. But when the cough is dry and non-productive, then you are thinking of COVID-19.
Okay.
COVID-19, we'll be able to defeat it. But we want the general public to henceforth take care of this. We are also, like I said earlier, appealing to the general public. We are all at home now. We are advising everybody to be at home. But a lot of things may happen in your home, so take very good care. I'm sure my boss, team leader, Dr. Ampoma from National Reconstruction of Plastic Burn Center in Kolebu, will shed light next time on home injuries and the rest. But we are very grateful to all of you. We are very grateful to Ghana and the EG, the government, and the general workforce of the Ghana's health workers. And those of you who are there praying for us, we are so, so grateful. We know you continue to support us and pray for us. Thank you so much for all the support up to now.
Thank you very much, sir, for joining us today. I'm sure that as we go along, we'll be talking to most of your colleagues, and the issues and the concerns that exist, we'll raise them and try and get the attention of the authorities so they can fix these problems. In the meantime, like I said, they're still calling for donations, and so we put that screenshot there on your screen for you to have a look at how you can help. This is something that's put together by the Ghana Association of Doctors in Residency. They're asking you to help fight. That is the code, the short code through which you can support is *88 *7*2#. That's how you can support. And if you do wish to do so, kindly help out. I've been talking to Sheikh Ibrahim Ibn Sana. He is a public health and infectious disease pharmacist, and he's head of pharmacy unit at Chest Diseases Kolebu Teaching Hospital. I'll end Frontline with this message that's coming from someone who doesn't add a name. It says, God bless all health workers who are risking their lives on behalf of the country and Ghanaians. Stay home to avoid the spreading of the virus. This has been Frontline.